Welcome to part 3 of 3 of the series on happy eating, developed in collaboration with dietetics, occupational therapy, speech and language therapy and CAMHS. Part 3 will focus on tools and strategies you can use at home with your child. What can you do? Hopefully from part 1 and 2, you will already be thinking about some of the things you can try at home to help improve your child's food intake and make mealtimes a happier experience for the whole family. There are many ideas here for you to think about. Some of them may be helpful for your child and others may not. Take note of the ones you think that might help. Medical issues. Ensure all medical issues are addressed and see your GP if your child has ongoing issues with reflux or constipation, for example. Skills. Provide opportunities to develop fine motor skills through play. This can help with handling of cutlery, for example. Environment and routine. Sometimes the best time to try new foods is not at mealtimes, in case it puts your child off eating. Eat as a family to model positive feeding behaviours. Encourage self-feeding to increase control and allow eating to appetite. Don't set too many rules, but be consistent. For example, the timings of meals and sitting at the table. Make one change at a time and use rewards as long as the reward is not food related. Do not react to negative behaviours. Be patient, this will take time. Anxiety. Provide opportunities to try new foods without any pressure to eat them. Get your child to be involved with cooking. Focus on discussing the food and not eating it. For example, where have the vegetables been grown or the different colours? Tasting plates or buffet style eating can help. You can try serving some family meals buffet style, where the whole meal is served as a help yourself meal. The children are then exposed to lots of different foods and may be receptive to putting something new on their plate, or maybe just touching or smelling it. Exposure to a wide variety of foods so that they can see and smell the food. Many children need up to 10 to 20 exposures to a new food before they will taste it. Sensory. The sensory ideas are covered in later slides. Tips on introducing a new food. When picking a new food for your child to try, pick a food similar to something they already accept. For example, if they like chips, then you might want to try a waffle or a boiled potato. It's usually best to stick to this one food for a period of time, rather than trying lots of new things, which may be too overwhelming. Try to involve your child to make the choice. It might be that they already have an idea, or that they have seen a food or snack in the supermarket that they would like to try. A pea-sized amount of the food is enough. Don't ask them to try the whole thing. Provide regular opportunities to try the new food. You could also try it away from mealtimes. Stages of acceptance. This is a staged approach to accepting a new food. As adults, we often ask children to just try a little bite of a new food. However, for a child trying a new food for the first time, it is a big step to go from never having tried the food before to then putting the food in their mouth and then swallowing it. It can be helpful to have a staged approach to this. Firstly, think about if your child can tolerate a food in their environment. Then, would they be able to touch it, smell it, kiss it, lick it, bite it, chew it, then eventually swallow it? Bear in mind that this might take several days or weeks. You would not ask your child to do all this at once. This may be something that is helpful to do at home with your child. Remember to get the child to help you choose the food that you're going to try it with.
Having fun with food out with the constraints of mealtimes is less pressurising and allows opportunities to create a more positive association with food. These can be offered in a variety of different ways depending on the age of your child and their preferences. Messy play opportunities can help to desensitise children's sensitivities, with reassurance that it is okay to be messy. This, of course, needs to be graded and offered at a pace that is suitable for your child, with opportunities for them to clean their hands if needed. Some children find it easier to play with messy play using a toy or harder object so that their fingers do not need to touch the messy play straight away. Some children like to play with food, in tea parties, with their toys, or in arts and crafts, which helps to engage in food in fun ways and can act as a less threatening environment to break down barriers around food. Involving children with shopping, baking, cooking or gardening activities can provide opportunities to be involved with food and learn about the properties of different foods without the pressure of eating them. For children with oral facial sensitivities, there are some strategies that can be tried to help desensitise as well as increase acceptance of objects coming towards the face, including regular opportunities for wiping their face and increasing tolerance of being touched, kissed by loved ones. A child can try putting on lip salve or rubbing their own gums or teeth, or use an electric toothbrush to desensitise their mouth and lips. Firm stroking symmetrical movements on the face towards the mouth can also help to desensitise the area. These can be tried as a preparation before mealtimes to reduce sensitivities. Ensuring your child is in a calm and positive state before challenging them to try a new food is very important. Relaxation and proprioception or deep pressure activities can help encourage calmness. Children who have difficulties with oral motor skills may also benefit from opportunities to work the muscles of the face and mouth. This can be done through fun activities such as blowing bubbles or blowing cotton balls along a track through a straw. We hope that these series of talks have helped you to identify what the barrier is for your child's eating and maybe offer some ideas of things to try to help and make mealtimes a more positive experience for everyone. If you still feel that you would like to talk to someone for more specific advice, please feel free to contact us on this email address with your child's name, date of birth and a contact telephone number, and one of us will get in touch to discuss.